Hey guys, welcome to the Chapter 8 recap, Social Insurance. Whenever you hear social insurance, think of Social Security, which should also allow you to think of Medicare. And that's really what it's going to be about, is mostly Medicare insurance and how it affects people above the age of 65. So let's go ahead and dive in here. The first thing to talk about is Medicare, and we're going to go ahead and dive into the basics. So what are the basics about Medicare? It is a federal medical expense insurance program for people who are age 65 or older, have been entitled to Social Security disability income benefits for 2 years, have permanent kidney failure, ESRD. So there's four different parts. And again, to qualify for Part A to automatically be enrolled in it, you have to have your Social Security and be fully insured based off the Social Security requirements, which is 4 years of work or 40 quarters. We touched on that on one of the other chapter recaps, but that's what this is talking about. This is how you can qualify at the age 65 or older. So there's four parts. Part A is hospital insurance, which is financed through payroll tax or your FICA. Again, guys, you've worked for 10 years plus, you've paid all your taxes to Uncle Sam. They take that FICA out of your check, and this helps pay for your Social Security and also your Medicare. Part B, medical insurance. This is financed by insureds, and general revenues. Part C, Medicare Advantage, allows for receipt of healthcare services through available provider organizations. Part D, prescription drug coverage. So, what is Part A? This is how you get enrolled. Initial enrollment period is when an individual becomes eligible for Medicare, starting 3 months before the age of 65 and ending 3 months after they turn 65. General enrollment period is between January 1st and March 31st. Special enrollment period at any time during the year if the individual or his or her spouse is still employed and covered underneath a group health plan. So what does that coverage look like? That coverage for Part A is going to take care of your inpatient hospital care. It's going to take care of skilled nursing care facility, home health care, and hospice care. Now, that's automatically enrolled if you satisfy the Social Security requirements, or not automatically enrolled, but you automatically are available and be able to be covered by Medicare if you satisfy those Social Security requirements of working for 40 quarters. Now, Part B is optional. It's offered to everybody who enrolls in Part A, and the coverage is a little bit extra. It's a little bit more outside of just that base Part A plan. So Part B, the coverage is doctor services, outpatient hospital services, home health visits, other medical and health services, prescription drugs, even though it's limited coverage, outpatient treatment and outpatient treatment of mental illness and yearly wellness visit. So obviously, Part A is a very basic type of Medicare and health insurance for people who are older than 65. Part B is totally optional and covers, the things outside of that basic Medicare policy. Part C, Medicare Advantage, requires enrollment in Part A and B, provided by approved HMO or PPO organizations. So again, for you to have Part A, you have to qualify the Social Security aspect of working for 10 years. For you to get Part B, you have to pay for it, but you have to have Part A as well. For you to get Part C, you have to have A and B to get Part C. Now, Part D, prescription drug benefit, optional coverage through private prescription plans that contract with Medicare. So if you have Social Security, you automatically qualify for Part A. Everything else is in addition to. So understand that, Part B, C, and D are optional. Primary, secondary payer. For individuals eligible for Medicare coverage who continue to work, the employer's health plan would be primary coverage, while Medicare would be secondary coverage. So, obviously not everyone just retires at age 65. Some people work longer. So the primary payer and the primary insurance policy for your health that's going to, take precedence is going to be your employer plan. And then secondary coverage is going to be your Medicare. So understand that as well. Medicare supplement policies, the basics. This is referred to Medigap, policies issued by private insurance companies to fill in the gaps of Medicare. Maybe you have that basic Part A Medicare, and there's still several gaps and several other benefits and expenses that you need covered. So coverage, Plan A, core benefits such as co-insurance, co-payment. Additional Part A has hospital costs, hospice care co-insurance, co-payment. Part B, co-insurance, co-payment. 3 pints of blood under Part A and B. This is kind of a weird thing that you might have to remember, but just know that, 3 pints of blood under Parts A and B. Parts B includes core benefits plus additional benefits. Guys, I don't think you'll have to have a lot of Medicare supplement questions, but it's very important to know they're probably primarily going to test you over Part A, B, C, and D. So just know that Part A is very basic hospital coverage. Part B is, the extras, the extracurricular type of, hospital coverage. Part C is Medicare Advantage, and then Part D is prescription drugs. So understand that. Medicaid. What is the purpose of Medicaid? It's medical care for those whose income and resources are insufficient, and it's federally and state funded. So if maybe you don't have a very high income level and you're what's deemed, underneath that level to, be able to qualify for Medicaid, that's who it's for. Medicare is for older people. Medicaid is for people who typically have less income. So understand the differences there. They might try to trick you, but Medicare, think of long-term care, anyone above the age 65, kind of, older people, your senior citizens. And again, Medicaid is typically going to be your lower income individuals. Social Security benefits. What are the basics? OSDI. That stands for Old Age, Survivors, and Disability Insurance. It's truly just an acronym, so make sure you know what OASDI stands for. Old Age, Survivors, and Disability Insurance. This provides disability income benefits. The individual must meet proper insured status, definition of the disability, and waiting period requirements. Okay, so guys, the insured status is just making sure that you qualify for Social Security benefits. Again, the 40 quarters, kind of beating a dead horse there. You have to meet the definition of disability, and you have to deal with the waiting period requirements, kind of the elimination period. Wait till those benefits are paid out after you've claimed the disability. Qualifying disability benefits, as if I haven't said it enough, guys, individuals must have earned 40 work credits for each year, 10 years, 20 of which are earned in the 10 years before disability. 5-month waiting period. Think of that kind of as like an elimination period. It's a very long time, 5-month waiting period, and benefits are based on PIA. So very important, guys, to understand the differences between the different Medicare parts. Know the basics of Medicare, but really know the difference of Medicare parts, Part A, Part B, Part C, Part D, and know the difference between Medicare and Medicaid, and then understand what it takes for you to qualify Social Security benefits and all the disability aspects in that sense to get through disability income. Guys, that's social insurance. It's not going to be a large portion of your test. Don't get overwhelmed or worked up about this particular section of the exam. It's not going to be a lot. They're going to ask really basic questions about Medicare. Like I said, they might try to trick you on Medicare versus Medicaid, and then you probably will have to know, and most likely will have to know, how you can become qualified for Social Security, which is 40 quarters, 10 years of work. That wraps up Chapter 8, guys. Thanks for listening.